Miss Howard? Hey, I'm Sam. I'll be your student nurse today. I'll be doing a head-to-toe assessment on you before I get started. I'm going to wash my hands real quick, okay? I'll be right back. Close for privacy. Cotton set. Hey, Miss Howard, I'm back. All right, so we're going to be getting your head-to-toe assessment. I'm going to ask you a couple questions real quick. We'll look at your armband real quickly. Can you give me your full name?
Elena Howard.
Perfect. What's your birth date?
10/18/1985.
Okay. What's today's date?
January 23rd.
Good. And you know where you're at today?
Chance.
Perfect. So you're learning-oriented times 3. It's person, place, and time, which is good. You're also speaking to me, so your speech is adequate and the quality is right. There's no slurred words. I don't see any face drooping or anything like that. I'm just going to look at your face real quick. If you go ahead and puff your mouth out for me. Perfect. Can you take a big smile? Good. And can you lift your eyebrows? Good. I'll just make sure everything's symmetric, which it is. Close your eyes for me. I'm just going to see about your sensation on your face. I'm going to touch a couple places. Just tell me where I'm touching, okay?
Forehead.
Good.
Cheek.
Good.
Cheek.
Good.
Chin.
Okay. Go ahead and open your eyes. See a good sensation on your face, which is good. I'm going to check your pupils. Take off your glasses for me. Okay. Go ahead and look straight at. Okay. Good. Good. So your pupils are equal and they're reacting to light. I'm also going to check for accommodation. Go ahead and stare at that wall over there for me. Good. Now look at my finger. Perfect. So your eyes do accommodate. Your pupils do get smaller and larger with distance. Your pupils are also about 3 millimeters, which is adequate for a regular sized pupil. I'm also checking your posture, which you have great posture, better than mine for sure. You also are in good hygiene. You smell good. Your hair and clothes are all put together, so that's great. I'm looking at your eyes as well for any discharge, any redness or anything like that. I don't see anything, so that's also great as well. I'm going to check your hearing, your gross hearing. Can you cover one ear for me? I'm going to tell you a word. Just tell me what it is, okay?
Dog.
Perfect. Can we do the other side?
Cat.
Good, good. I'm also going to look for any discharge or redness in your ear, any extra ear wax, which I don't see. Come over here and check this side. Good. Nothing there, so that's good. I'm also looking at your thorax, looking for any barrel chest, and I don't see that either. You're also in APT 1 to 2, which is good, is what we're looking for. I'm also looking at your depth of your chest as you breathe. I'm looking at the rhythm of it. It's adequate. You're not using any deep breaths or struggling to breathe. There's no intercostal muscles that you're using, accessory muscles that you're having to use really hard to breathe. So that's good as well. I'm going to check your nose. Just looking inside for any discharge or any redness or anything like that. Can you hold one side of your nose for me and breathe in? Good. Can you do the other side? Good. So your airway there is patent, which is great. You open your mouth for me. Just going to look inside your mouth. Teeth are in good repair. Looking for any lesions or sores. Can you lift your tongue for me? Good. Nothing underneath the tongue as well. So that's great. Your oral mucosa is pink and moist, which is also what we're looking for as well. I'm going to check your pulses real quick. Check your carotid pulse. I'm going to do one at a time. That way I don't push it and you don't lose consciousness. Good. And I'm checking for to make sure that both sides are symmetric in strength. And they're equal, which they are. About a 2-3, which is good. I'm going to check your brachial pulse here as well. I'm doing the same thing, checking for symmetry and strength. Good. It's also 2 to 3. I'm going to check your radial pulse here. It's also equal and symmetric as well in strength. There's also 2 to 3. Can you put your fingers out here? I'm just going to check for capillary refill. Good. I can see that. I'm going to check your toes as well for capillary refill as well. Good. Great. Tell you what, can you swing your feet over here for me real quick? Wonderful. I'm just going to check your pedal pulse real quick. So it's about a 2 in the strength. It is equal on both sides. I'm going to take your posterior tibial pulse here. It's also a 2 as well. Okay. Swing your legs over here. You're comfortable facing me again. Okay, so I've done your eyes and your ears, your nose and your mouth, and your neck. Can you go ahead and look that way for me? Perfect. Now look back. Look over there. Can you look straight up and look down? Good. So you have good movement in your neck. Go ahead and listen to your heart real quick. If you don't mind flipping your hair in the back for me. Perfect. Okay, so I'm going to go about mid-clavicle here, 2 spaces down, 2 intercostal spaces, and I'm listening for the aortic valve. Good. I'm going to come over here to the left of the sternum, in the same location, about mid-clavicle, 2 intercostal spaces down. I listen to the pulmonic valve. Good. I'm going to come over here. I'm just going to go 1 more down, which is the 3rd intercostal space. Left side of the sternum, listen to the Erb's point, which is where the S1 and S2 are. Good. I'm going to come 1 more down here, which is 4th intercostal space. And I'm listening to the tricuspid valve here. Good. I'm just going to go underneath your shirt here. I'm going to be listening to the 5th intercostal space here, the mitral valve, which is going to be basically right underneath the bra line there. Good, everything sounds great there as well. Don't hear any palpitations or any kind of murmurs or anything, so that's good. I'm going to listen to your lung sounds now as well. If you can take some deep breaths for me, breathe in and out of your mouth. Good. I'm just going side to side, that way I can compare each side of your lung. Good. Just going to go down about 2 inches here. Good. I'm going underneath your shirt here and listen. Good. Come on the other side. Good. I'm going to listen to the side of your lungs. Go ahead and raise your arm up for me. Okay. Just going to go down just a little bit. Good. I'm going to come listen to this side now. Good. I'm going to go down just a little bit. Good, everything sounds clear there. If you go ahead and swing your legs, I'm just going to take a look at your back and listen to your lungs and your back as well. Go ahead and raise your arms forward for me. Just put them across you. Perfect. Just take deep breaths through your mouth again. I'm going to keep it in between your scapula here. Good. Just going to go down a couple inches here. Good. A little bit farther. Good. Everything sounds clear there. I'm just going to look at your spine real quick. Just looking for any curvatures. Just make sure that it's straight. There's no pain when I push here. Good. Okay, you go ahead and turn back towards me real quick. Okay. Tell you what, I'm gonna have you come lay down over here. Okay, before I get started on your abdomen, I'm just gonna check your extremities here for your temperature, make sure there's no lesions on there. I'm also checking for symmetry in your muscles. So I'm just gonna go down your upper extremities here. Temperature's fine, muscles all feel intact. Don't see any lesions as well. Going down your legs, also don't feel anything. Muscles are symmetric. I'm also gonna check your calves here for any edema. I'm checking that by the turgor pressure here. I'm just making sure that you have good rebound here. Check this side. Good, and your temperature is good in your legs as well. You go ahead and push against my hands. Good, can you push down? Good, can you move your feet all around? Okay, so you have good movement there, good strength in your feet. I already checked your capillary refill. Okay, I'm gonna check out your stomach. Can you lift your shirt up just a little bit for me? Perfect. Now I'm just inspecting your abdomen, looking for any lesions, any scars, any kind of masses there, any pulsing that I see, but you don't see anything like that. Stomach's also flat, it's not too much inclined or protruding too much, so you have a very nice flat stomach. I'm going to take a listen here to your bowel sounds. I'm just listening for some gargles and some different sounds here. I'm going to start in the right lower quadrant. That's where most activity is. In the right upper quadrant here. And then the left upper. The left lower. Good. There's lots of activity there. Probably kind of hungry. I'm going to eat that rice up there. I'm going to just palpate your abdomen as well. Just let me feel any tenderness or anything that's painful for you, okay? I'm checking for any masses or any kind of protrusions that I can feel. I'm also checking your face to make sure you're not grimacing when I'm palpating the areas. No pain when I do that. Okay? And put your shirt back down for me. I'm going to have you come over here and sit up on the bed. Can you push against my hands? Good. Can you pull? Good. Can you lift your legs up? Good. Pull them down? Good. So you have good strength in your lower extremities. Can you stand up for me? Perfect. Put your hands out to your side. Good. Push up. Good. Now push down. Good. Bring them forward like this. Now just pull them back towards you. Good. Now push them. Good. So you have good strength there in your upper extremities. Can you move your arms all around for me? Put them above your head. Put them behind your back. Good. So you have good movement, which is good. Go ahead and walk across the room for me. Just looking at your gait, making sure that it's stable, that you're balanced. You don't have any kind of. Go ahead, come on back towards me. Good. Good. So your gait looks great. Go ahead and stand here. I'm just going to push against you a little bit. Just checking you're good. Okay. Good. Just resisting you there a little bit to make sure that your balance is good, which it is. Go ahead and come back over here and have a seat for me. Now I'm just going to check your temperature in your lower extremities real quick. Temperature's good there in your upper extremities. You have good temperature there as well. So I think that's it. I think that's everything. We evaluated you pretty well. Give you your call light. Here's your call light. If you need us, just give us a call. You have any questions or concerns for me? Okay, good. All right. Well, I'm going to go document everything, go wash my hands, and give you some privacy, and just call us if you need us, okay?
Okay.
All right.